What do you, when you're hearing from what's happening in Washington, D.C., does it scare you? And if it does, what scares you the most right now?
There certainly is an unknown factor, and that's what doesn't make us feel comfortable. In medicine, there's always a lot of unknowns to deal with, but we like to at least know a few steps ahead what the plan is. And here, because things get shifted back and forth on a daily basis, a lot of that unknown factor is there, and a lot of physicians, for the most part, are just trying to figure out where they take part in all of this, and nobody knows that answer for sure. It seems like whatever happens, things are going to change slowly, and nothing's going to change too drastically, which is somewhat of a comfort for a lot of people. But in the long scheme of things, just that unknown factor is what makes a lot of people nervous.
Do you guys feel that you're more nervous in your position and being in your involvement in a medical center than if you were, let's say, Liza Capiello, or a doctor that didn't have those responsibilities?
As managing members of a facility, yes and no. We still have responsibility to look out for the best interest of our center. And whether it's for Liza or for Dr. Azzizadeh or anybody else, or just the viability of the center, it puts us a little bit more in the spotlight, but at the same time, it gives us a little bit more access to talk to different people, ask around, talk to people like Eric and the attorney, just to feel a little bit more comfortable that things are going to still be a little bit more protected for us. I'm not sure how Babak feels about that, but
do you agree?
Yeah, I mean, obviously, I think we feel a certain amount of responsibility for our members because they've, in a sense, given us their trust to run this organization, and we want to make sure that the entity does well. Provides good health care for their patients and for our patients, and also at the same time, the economy or the economic aspects of it continues to work well to a certain extent. So I think healthcare reform, like Siamak was saying, has a certain amount of uncertainty, but as a whole, I don't think it's going to affect surgical centers or healthcare entities a significant amount. But what it will do is, I think, they're really rearranging a significant amount of the economy as a whole, and that's going to, I think, probably put a lot of stress into the system, and that's what's really more of a macroeconomic aspect that scares, I think, most of us more than anything else.
Patients. How do you think it's going to impact me as a patient?
I think it's going to have a tremendous amount of impact because quality of care will certainly go down. I think as what they have right now, because what's going to happen is, especially if there's a public option is going to probably, that type of insurance is going to be somewhere in between what Medicaid and Medicare are. Medicaid is, really, I think right now, provides just enough care for patients. Medicare provides excellent care, but PPO provides exceptional care. So it's going to drive a lot of big organizations to say, I'm not going to pay, Aetna, Blue Cross Blue Shield. I'm going to just go with the public option. It's going to have bare minimum of services and so forth.
It's kind of like rolling the dice.
Yeah, I mean, because it's going to save, big business money by doing that, because you can't really compete with the government and services. And I think that's going to, those reimbursements for physicians are going to force physicians to stop accepting even Medicare and, public option. And therefore, we're going to create a two-level playing field for people who can afford to pay physicians and for people who can't. So quality of care, I think, will suffer.
One last question. You want to get back to something you said. Information, or lack thereof, or a resource for information. As physicians, do you feel like there isn't a central place where you're getting it, or do you think there should be? And is it hard to get the information you need? You feel like you're out of the loop?
CNN.
Yeah.
We're getting our information
From where I'm getting
News.
mine.
yeah,
So you feel like
CNN,
you're-
Fox
you feel like
News,
you're- you feel like you're educated.
MSNBC.
You feel like you're as educated as I am on this?
Absolutely.
Yes.
We get alerts, the
Yeah.
same alerts that you get.
Yeah.
Last night, Senate passed the bill, and I was reading through and looking at the taxes and what services they're going to take away, and or what services they're going to, I don't think the problem also is if healthcare reform is needed desperately. But really, the whole premise of healthcare reform, obviously, you want to improve access. But the other thing is we have a runaway train in terms of costs. But when you have healthcare reform that doesn't do anything about costs, really, and in fact probably will create, another entitlement program. That's all we know. I mean, because we're, 2,000 pages of, in the House bill, I don't know how many pages the Senate. Who's going to sit down and decipher that? It's going to be bureaucrats and government, and who knows what's going to happen.
I feel like it's ironic. It feels like as physicians, you're the most important part of this, and you're the least engaged.
Absolutely.
Yeah, and all they wanted was a stamp of approval from a couple of things, which they don't really represent most doctors. They represent the bureaucratic system that they're in. So it's unfortunately, I think, a very difficult situation for everyone.
Yeah, and as you talked about information, in the era of information and how it's available to everyone, as we all said, get the same information as anybody else. We may hear about it an hour earlier than everyone else if we have access to some of these email blips or whatnot. But for the most part, what we know is what everybody else knows. But what we do have access is our patients. And I'll tell you, the patients for the most part are very, 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 not just educated, but also very concerned. As much as the physicians may be concerned, I think the patients are even more concerned, especially the senior patients.
Do you think
the
the
patients who are
patients-
Medicare?
Patients are on the same page as you, as the physicians, and do the patients feel that if you aren't covered in this, or you are engaged in this, or if you're uncomfortable with this, they feel that they're uncomfortable with this, or
Absolutely.
do they feel like, hey, as long as the government's going to cover us, or there's somebody covering us,
No, they don't think that. They have a feeling that the government is not out to look for them individually for their best interest. They really look to the physician for that. And if the physicians are going to suffer in this, they feel that primarily they're going to suffer out of this as well.
They're getting exceptional care for the most part. If they're coming to our offices. I'm not talking about us, but just physicians' offices.